Greetings once again. It's been a pleasure, and it's a pleasure to be back again for these particular sessions. I know we took a break, and that break actually wasn't necessitated by the particular topic that I'm going to talk about. Last week, I wasn't able to share a video with you all, and the reason was because I was out for the Annual PSK Conference, and that is the 42nd one that was happening in January in South Coast. So the main thing that I'm going to talk about is linked to the theme of that particular conference, and this was disruptive advances in pharmacy for improved healthcare delivery, for improved healthcare as it is. And we know as pharmacists, we're healthcare practitioners, we're healthcare stakeholders within the healthcare space. And therefore, our main mission in terms of service delivery is to ensure there's better access to healthcare services to the patients and to the population that we serve. And on that account, then we have to be cognizant that we are not working in a confined environment. We are not working in a cocoon in some way. We are working in an integrated network that is not only within the national framework, in the regional, continental, global, and the world is a global place. As much as it's getting global, it means advances are there. We need to take advantage of them and see what next and how do we be better professionals and where do we grow as individuals. And this is one thing that is very clear for us. As we went through the conference, there were some things that were coming out. As healthcare professionals, we have so much that we need to do to serve the population that are dependent on us. That is the first principle. On the second bit, you're only able to do it when you have something for yourself. You're able to provide for your family. You're able to meet your day-to-day needs. And that is where we're now looking at it in terms of what are the incentive models for you as a practitioner. And finally, what is the change that you're envisioning for that future? And if you look at the theme for that particular conference that we had, it is disruptive advances in pharmacy for improved healthcare. And one of the critical bits that we all have to acknowledge is that disruption is the new normal. Everybody is venturing into this pharmacy space. And it's not only because there's a business case that is there, but it's also because that is where there's tangible impact on what you do, where you do it, and there's transferability in terms of return on investment. So when we look at that, we know the supply chain landscape is rapidly being transformed. There are so many buyouts, takeovers, and all that, with a major focus on streamlining the pharmaceutical supply chain model. And when we look at that streamlining supply chain model, we're looking at are we going to reduce the cost of medicines to make them more affordable? How are we going to ensure that medicines are accessible when and where people need them, reliability and the convenience? That is why we're having digital people who are coming in, the digital disruptors, technological advances. And then finally, the financing component. There's never going to be innovation when there's no financing for that innovation. And once innovation has been financed, then the financing that is also there to make it accessible to people. And that is why we need to buy medicines. Who is going to buy it? Who is going to finance the buying? Then we move from that now, the medicines is available in our ecosystem. They need to be used by patients. Who is going to actually deliver it in the best way possible to that particular patient? The clinical pharmacist where you are. How are you going to respond actually to envision this new feature for us? And these are some of the conversations that we're going, registering medication, that is regulatory harmonization, trends that are coming, the business case, the design thinking. Can we think for a system, not a part of the system? Because we are part of a system. We need to think for the system and with the system so that at the end of the day, as far as we're going, we are able to find what are the gaps, where do we need to go, and how do we make that kind of a framework work for all of us and integrate our health ecosystem in the healthcare space. And those are some of the key things that are coming up from the conference, from the discussion that we're having, and also emerging entrants into the market. What are they doing differently? And how can we position ourselves not only to be part of the team that is disrupting the industry, but to envision a better future so that the disruptions do not kill us. We all know the impact of the phone into Kodak cameras. Kodak was in the camera space. Mobile phones, when they came with cameras and all, Kodak is a long gone story. So how do we envision ourselves and get ahead of the curve and make it better? And from the discussion that we had, there are critical bits that we all have to acknowledge and we all have to be cognizant about in terms of how we are moving forward. We need a strategic direction on where we are heading. And as an organization, as individuals, we all know every organization has a mission, vision, and a core value system. So what is our strategic direction? Where are we getting to? We need to know where we are going. From a pharmaceutical society perspective, I believe as pharmacists, as professionals, we know we have a direction towards our common mission of delivering quality healthcare services reliably and effectively to the patients who need them. That is our mission. And therefore, in terms of pharmacy practice, we're almost synonymous to medicines. Our focus area should be one, medicines, and beyond medicines now in the healthcare system. How do we strengthen healthcare systems to have these medicines getting to the patients who need them timely, affordably, conveniently, in the right way, in the best possible way possible for us all. So once we have that strategic direction, it means our role starts from the general clinical care level at the lowest level, dispensing of medication, to the highest level where we need to make policies and set direction on how these medicines are going to be procured, who is financing them, how they're getting to the patients, who is handling them before they get to the patients, and who is monitoring the impact of the medicines upon use by the patients. Once we have a strategic alignment and focus on that particular role, then the next bit for us is to know we need leadership. Leadership is going to set that direction, but if we don't have leadership and we don't have direction, we are all gone. And therefore, that is why we need leadership. And some of the key advances that we now acknowledge is that from a PSK perspective, we have a CEO, a substantive chairperson, and the vice president. Actually, there are also 3 appointed vice presidents at the moment. And these are people who are supposed to drive direction in terms of helping us get to where we need to be. And I'm hoping that leadership is going to be robust enough to help pharmacists realize the potential that lies within them. And once we do that, we are able to go where we need to go. And I'm just reflecting from a conversation I had with some senior colleagues. Some of the key conversations that we had, some of the key topical theme areas that came was the fact that one, as pharmacists, we have so much power. We have so much potential that lies within us. Unfortunately, based on practice and based on the standard environment that we are operating in, it's not only pharmacists, but every other person. We have power that lies in us. Some of us don't know we have that power. So therefore, the first mission is to help us realize that we have so much power within us. 2, some of us have already realized we have that power. Then we don't know how to use that power. So then the person who knows they have the power need to be guided on how to use that power. And that is the other role of leadership. Then once you've been helped to know how to realize, to use that power, then you need to be guided on where to use that power. And that is the other side of leadership, where we're seeing the vision coming into place. And that is what we need as a profession, as a society, to ensure that as pharmacists, we are not being left behind, but we are shaping the future of practice. We are being guided to where we need to be, and we're taking responsibility. And once all this has been done, we need to make a conscious commitment and dedication to pursue this end. If we are not committed, if we don't buy into the vision and we're not doing what needs to be done, we'll have lost the battle. And that is where we need not drop our guard. We need to be alert and we need to be proactive enough to champion for that next phase where we are going to. So what are the common next steps for us in terms of disruptive advances in our pharmacy practice? First, before you look ahead, you need to know where you are. And where we are is the core of our work has been in medication, medicines management, and all that, from supply chain, dispensing, pharmaceutical care, clinical pharmacy practice, and dealing with the medicines. That is our core practice. So we have to ring fence and actually anchor ourselves as the key people who drive that conversation. If you leave your house going to look for more outside without guarding it, somebody will take your house. So how do we ensure our place is guarded and secure? That is the first thing. And in that case, some of the conversations that were coming out is that we're looking at a pharmacy practice bill. How do we have a pharmacy practice bill that will entail what we need to be doing in which places we are practicing? That is the first place. We need to use that to guard our medicines, to ensure that the patients are secure, knowing that medicines are being handled by the qualified professionals, being dispensed by qualified professionals who are guiding them and ensuring that at the end of the day, there's never a gap in access to their medicines. Affordable, quality, effective, safe, everything that contains medicines, we have to reinvent that and ensure that is where we operate. Then with that, we now look at the disruptive advances. I'm talking about supply chain regulatory frameworks. We're talking about quality pharmaceutical care, primary healthcare system, health system strengthening, financing models that are coming up, the disruption in terms of technological advances. When we see all these advances as they're coming, we need to envision that new frontier. And in envisioning that new frontier is knowing what are the possibilities? How do we get to that future? And are we able to work on it? Once we've envisioned it, let's venture out and conquer new territories. There's never any battle where somebody left their captured territory to go look for new territories without guarding what is already theirs. because that will be stupidity at the highest order. We need to guard our ground, that is fencing what we have, envision new futures, and venture out. We can't win those wars unless we go for it. And these are also some of the conversation, looking at it from a young pharmacist perspective. We've been driving this conversation among the young pharmacists group. How do we get mentorship for young pharmacists? How do we get jobs for young pharmacists? Unemployment is right with us. So how do we do this? And the quick aspect that came was the fact that we all want this, but as much as we want it, we are not going out to ask for it. I would go as David to look for mentorship opportunities for other young pharmacists. But unless these young pharmacists take lead, go for those mentorship opportunities that they need, they'll never get them. Unless they seek out the employment opportunities and apply for the jobs that are being advertised, they'll never get them, but we will be complaining. So are you venturing out to actually acquire that new ground that you wish for? And once you've known that, the next bit for us is we don't work in isolation, we work with others, we work in an ecosystem, we work with different people. And on that account, then the next phase for us is to recruit as many allies, make partnerships, make collaborations, and have it based on what is our strategic direction. We know where we are going. Then once we know where we are going, get people who can help you get to that particular goal faster, the best way possible, and with sustainable success measures. And if we're able to do that, we'll be at a better level. And I think that is what we need all to commit to. Our strategy has to be bulletproof. We have to be consistent. We have to be committed. And we have to realize that there's so much power that lies within us. And once we know that power lies within us, let's make the best of it. And I believe we'll be having a better profession. And one of the quotes that I would just take from the discussion that we had in one of the breakout sessions, there's so much potential out there. We are in a world of possibilities. And knowing that we're in a world of possibilities, the question is, how are we taking advantage of this? We might not be many in numbers, but we are many in our intellectual capabilities, in the knowledge that we have, and our abilities now take advantage of knowledge. We are in a knowledge economy. Are you able to commercialize your knowledge? Are you able to optimize return on investment from the knowledge that you have? We might not have the numbers, but we have people who have knowledge. We have people who can open doors when you need them once you know where they are. So realize that the potential lies within you. And once you realize that you have potential, know how to use that potential and then plug in to make the best of it. If we're able to do that, we'll have transformed our profession and we'll have responded to the current needs of our societies, making the profession thrive rather than survive. And I know we can do it. Thank you and see you next weekend.